My name is Stephanie Blokland, and I am reporting live from Red Deer Polytechnic as cases of emphysema are on the rise. Emphysema is a chronic obstructive pulmonary disease caused by damage to the alveoli in the lungs. Due to dangerous environmental factors and the ongoing presence of smoking, emphysema involves the breakdown of the alveolar walls, resulting in an irreversible decrease in respiratory function. In order to thoroughly explain the effects of this disease, local healthcare worker Kelsey Lundstrom has volunteered to present viewers with extreme inside details on the prevalence rate, risk factors, pathophysiology, and symptoms of emphysema. Among Canadians ages 35 to 79, 14% have been diagnosed by a healthcare professional with emphysema. Additionally, it has been shown that women were 5% more likely to report a diagnosis than men. The common risk factors for emphysema include previously acquired respiratory infections, air pollutants in the home, and exposure to dangerous chemicals in the workplace such as welding and mining. Hereditary deficiencies are also a concern for emphysema. The absence of a specific gene responsible for coding alpha-1 antitrypsin proteins results in a lack of protection in the lungs from harmful irritants and infections. However, smoking is recognized as the primary risk factor. Because of this, emphysema is one of the most preventable types of respiratory diseases. The lungs in a healthy adult function to transfer oxygen from the outside air into the body while transferring carbon dioxide from the blood out of the air enters the body through the nasal passages or the mouth and travels through the windpipe, bronchi, and bronchioles to reach the alveoli, where diffusion between oxygen and carbon dioxide occurs. The alveoli in a healthy lung absorbs oxygen from the outside air and transfers it to the blood, where it will then circulate throughout the body. In healthy lungs, the alveoli are elastic and covered in surfactant, which is a mixture of fat and proteins produced by the lungs that works to coat the alveoli, allowing them to expand and deflate easily while breathing. Therefore, stretched alveoli, collapsed bronchial tubes, and overinflated lungs would not be present in a healthy adult. The development of emphysema occurs to immense amounts of inflammation in the lungs. With regards to smoking and other harmful irritants that are able to enter the respiratory system, beneficial lung proteins are broken down. When the lungs are not able to produce proteins such as alpha-1 antitrypsin, the lungs are then not able to inhibit the inflammation developed from irritants and infections. This allows inflammation to destroy viable lung tissue and decrease elasticity in the walls of the alveoli. Due to this damage, the stressed alveoli cannot support the bronchial tubes. In effect, this decreases the surface area available for gas exchange and creates an obstruction resulting in a collapse in the bronchial airway. As a result, due to the difficulty inhaling and exhaling, air remains trapped inside the lungs, decreasing the amount of oxygen entering the bloodstream. Furthermore, due to the chronic inflammation, weakened lungs, and exposure to harmful irritants, mucor hypersecretion is promoted and activated as the alveoli begin to narrow and overinflate. In addition, when the alveoli lose their elasticity, they are no longer able to bring in enough oxygen while getting rid of carbon dioxide. This is going to lead to an acid-base problem known as metabolic acidosis. When comparing and contrasting normal physiology versus the pathophysiology of emphysema, the major differences lie in the alveoli of the lungs, surface area available for gas exchange, bronchial airway, lung tissue, and the presence of inflammation. The primary symptoms of emphysema include frequent coughing and wheezing, shortness of breath and rapid breathing, long-term mucus or sputum production, and ongoing fatigue. Oftentimes, emphysema symptoms may not be noticed until 50% of the lung tissue has been destroyed. In addition, people who develop emphysema have an increased risk of pneumonia, bronchitis, and other lung infections. When connecting the symptoms of emphysema to the pathophysiology of the disease, it is noted that coughing is due to the hypersecretion of mucus, shortness of breath is due to the collapsed bronchial airway, increased mucus production is due to inflammation, weakened lung tissue, and exposure to harmful irritants,
And fatigue is due to the lack of oxygen and the small surface area for gas exchange, as well as respiratory acidosis and the unbalanced acid-base level. Emphysema affects the body's homeostasis by decreasing the surface area available in the alveoli for gas exchange. As a result, the human body is unable to inspire enough oxygen and expire carbon dioxide. This promotes hypoxia and unbalances the body's homeostasis, leading to an acid-based problem known as metabolic acidosis. Proteins play a major role in emphysema due to the presence of inflammation in the lung. Inflammation produces several important proteins known as protease enzyme, as well as alpha-1 antitrypsin, who are both responsible for breaking down enzymes. In addition, the protein elastin is responsible for the recoil in the pulmonary tissue. The cell membrane is important in emphysema as all of the major proteins correlated with this disease are found within the cell membrane. Alpha-1 antitrypsin, protease enzyme, and elastin are all embedded within the cell membrane. In conclusion, emphysema is a chronic obstructive pulmonary disease caused by damage to the alveoli in the lungs. The main risk factors for emphysema include smoking, air pollutants, hereditary genes, and workplace occupations such as welding and mining. When affected by emphysema, primary symptoms include shortness of breath, an ongoing cough, long-term mucus production, and fatigue.
Question 1. Fill in the blank. Blank is the primary risk factor of emphysema. Question 2. Fill in the blank. Emphysema is associated with occupations such as blank and blank. Question 3. True or false? Emphysema increases elasticity in the alveolar walls and increases the surface area for gas exchange. Question 4. Define alpha-1 antitrypsin. Answer 1 is smoking. Answer 2 is welding and mining. Answer 3 is false because emphysema decreases elasticity in the alveolar walls and decreases the surface area for gas exchange. Answer 4, alpha-1 antitrypsin is a protein found in the bloodstream that works to prevent the lungs from the harmful effects of irritants and infections. My partner Kelsey and I would like to thank you all for taking time this afternoon to listen to our presentation. It is our hope that you are all able to leave today having learned something new.